Just before the commercial break, Javier went into our latest numbers regarding coronavirus here in the state of Arizona. And I want to bring you back to this graph here. This is the graph on our website, azfamily.com, and it shows the positivity rate that is being reported by both the Arizona State Health Department as well as Johns Hopkins University. And you can see there is a noticeable difference in the rates that they are both reporting, and we wanted to know why that is exactly. So earlier this week, AZ Family anchor Chris Pickle took a closer look. Basically, there are some labs here in Arizona that report their positive tests, but are not able to report their negative tests because of basically a computer compatibility issue. So Arizona's State Health Department chooses not to include those positive tests when calculating the positivity rate. However, Johns Hopkins does include those positive tests in their statistics, even though they don't have the negative tests. So, bottom line here, which number is more reliable? Which one should we trust? Should we trust one or the other more? We decided to turn to a real expert. Dr. Billy Foster is a health economics professor at ASU. One of his main focuses, statistics. To say that analyzing coronavirus numbers are within his wheelhouse would be an incredible understatement. But we wanted to turn to Dr. Foster to help us understand and really delve into these numbers so that we can make good decisions for our families. Dr. Foster, good morning to you. First of all, I want to say thank you. You put together in the past 24 hours an incredible analysis of Johns Hopkins numbers as compared to Arizona State Health Department numbers, and we're going to put that full report on our website so people can digest that. But let's start with the positivity rate itself. Why is it so important? You gave me 3 reasons in your report. Why is it so important that we consider the positivity rate?
Well, first of all, we're trying to answer the question, how prevalent is the disease in any given community, right? And this is the measure that the state and the federal government have decided to use in order to determine that. And Arizona specifically is tied its public policy in several areas to this specific metric. But we've got some inconsistencies between Arizona Department of Health Services and Johns Hopkins data dashboards.
And you know, Dr. Foster, let's talk about those inconsistencies. As I read through your report, again, incredibly extensive. You've got to take some time, folks at home, to read this on our website. But you found, as you tried to recreate some of the metrics for Johns Hopkins, you found consistencies with their numbers. But you said in your report that you found several inconsistencies with the State Health Department. Can you explain?
Well, so I tried to put everything back together for each site based on the data listed in each site. And so Arizona Department of Health Services had told your station earlier in the week that their numbers were lower because they didn't include these
the positive and negative cases.
Right.
Yes.
The reporting was off because there were some places that didn't have negative cases listed in their report. So they dropped these, right? So the Arizona's numbers assume that the results from these facilities have about the same average positivity as the rest of the sample and discards them. So that sounds bad. But the Johns Hopkins methodology treats these clinics as if they have 100% positivity in their testing.
Which also is not true.
Right. So neither one is correct. And then another way to look at it is to say that the Johns Hopkins report treats all of the unreported negative tests as if they never happened, while the Arizona methodology treats all of the reported positive tests from these sites that are incomplete as if they never happened. So neither of those is true either. So
So Dr. Foster, that would lead you to believe that the state's reporting positivity rate would be maybe artificially low and Johns Hopkins maybe artificially high. Is the truth really somewhere in the middle?
Right, and that's the best we can say, right? They the Arizona number probably serves as a good lower bound, while the Johns Hopkins number is probably a reasonable upper bound. And they start to converge over time too. So if you look at them side by side, you can see that, as we're as we're moving forward, they appear to get closer together. But also testing numbers are down, and that leaves greater room for error.
You know, also in your report that you submitted, and again, we are going to post it on azfamily.com. Let's bottom line this, because at the end of the day, Dr. Foster, what anybody at home, what school boards, what businesses are trying to decide is the risk assessment. And so because of the inconsistencies with positivity rate, you were saying in your report that maybe there are other metrics that we should look to that are more reliable.
I mean, the one that I think everybody's going to agree on is if you take a look at cases per population and deaths per population, right? Because these are metrics that, you know, the top part and the bottom part in this percentage that we're reporting are going to be less disputed by different agencies.
And maybe those numbers, as you say, may be a little bit more consistent. Dr. Foster, again, thank you for your work. I really appreciate it. Thank you for helping us to understand what is incredibly complicated, especially for those of us who don't have a mathematical mind. So maybe we can check back with you again, if you wouldn't mind coming back to Good Morning Arizona so we can analyze the numbers even further. Would that be all right?
No problem. Clarification is key, right?
Yeah, and I know you start classes next week, so go Devils. I'm a Sun Devil myself. Thanks, Dr. Foster, for your time.